Today we're talking about something a lot of moms think about but don't always say out loud. Pregnancy, childbirth, and motherhood change your body in ways that no amount of crunches, clean eating, or willpower can easily fix. And here's the truth we don't hear enough. That doesn't mean your body is broken. We're diving into the Mom Bod Reboot, Mommy Makeover 2.0, because the conversation around mommy makeovers has evolved. We're revealing how modern mommy makeovers are more personalized, safer, and focused on restoring confidence, not erasing motherhood. Stick around. This is the checklist you need before you book a consultation.
Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Garrett Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Evon Zoog, also known as the Doc Dudes.
Welcome to the Doc Dudes. I am Dr. Garrett Harper, joined by
Dr. Evon Zoog.
We are both board-certified plastic surgeons, and today we're shifting our focus to a critical part of the patient journey, the mommy makeover. We're looking beyond just surgical technique and focusing on the critical questions you need answered to ensure your safety, satisfaction, and comprehensive well-being. All right, so Evan, let's talk a little bit because I would say for the, bulk of our practice, certainly the majority of our practice are mothers at some point in their lives. And so they come to us for restoration. A lot of people come with their pre-pregnancy pictures and say, this is what I want to look like. I love the way, not everybody. Some people have never really loved their figure and have always wanted to make changes, but they're kind of like, well, having these kids and focusing on motherhood, which is a very unselfish thing, they finally get to the point where they're like, you know what, I want to look after myself. I want to do something for myself. And so we see a lot of moms in that scenario. So talk a little bit about what is when we say Mommy Makeover 2.0, what does that mean? What are we trying to get out there for these moms to try to understand?
Yeah, so I think that, I've always approached it the same way.
Yeah.
But what patients need to understand is it's not just a one-size-fits-all kind of thing. It's not improving the aesthetics of your breasts and your tummy. It's really an individualized approach. And most patients, when we do a mommy makeover, there's lots of little things that we do differently on each case to add up to a great result for that patient.
Sure. And technology's changed, right? Whereas, you used to have, either a saline or a gel implant. Here it is. Take it or leave it. Technology's changed on implants, right? Placement of the implant has changed dramatically for people from a liposuction standpoint. Tons of technology, just because there was so many problems with some of the older kind of generations and thought processes of liposuction. So, we've got adjunctive things that we have in our armamentarium to help make a really good result into just an absolutely stunning result. And so the good thing is that, when patients come in, the most important thing is for them to feel like they've been heard, like we are listening and that we are prioritizing with them so that, when they leave, all their questions are answered. And when they're done with their surgical and healing process, we reach their goals. And, it's kind of funny because you don't, I always say, I'm not the boob police. I'm not, I don't want to do 20 surgeries and everybody be able to kind of, I think Garrett did that one. Yep, you can tell. That's his signature. Because what I want for you, I want to reach your goals, and I know you do too.
Exactly.
Yeah. So it's one of these things where I try to be as approachable. I try to be as affable. I try to be as least anxiety producing personality as I possibly can be, because I know that these are, it's stressful to come tell somebody, hey, I'm just kind of meeting you and I don't like this about my body. Like, it's very personal. So I think that when we create an environment for our patients to feel like calm and relaxed and realize that they are not alone. And that
I think we're both really, really good at talking to patients in a way to educate them on what things that we can do to help and to reach their goals. And I'm just here to talk to you and educate you about what's your goal?
Yeah.
I'm not going to tell you this is what you need to do, or this is the implant you need, or this is, I know. I
thought I would love that patient that would come in and just say, tell me what you think I should do. And I'm like, I don't want that.
No,
that's my least favorite patient. I'm like, I don't. Or, somebody will get done with a portion of a consultation and they'll say something like, they'll want to, it's not even on their sheet, right? Like, we'll talk about their breasts and they're like, well, because at that point, maybe they're feeling a little bit more comfortable after they've met us and they're kind of like, oh, okay, like this was easier than I thought. And then all of a sudden they're like, well, what about my tummy? I'm like, what about your tummy? Like, what bothers you?
Right.
And so like, I wasn't going to bring anything up. Like, if it doesn't bother you, it doesn't bother me. And so, but obviously something does. So yeah, show me. And then you can kind of diagnose the problem. You can tell them what you think is going on. And with moms, we'll talk a little bit about this diastasis recti that everybody wants to say incorrectly or categorize as a hernia, or other doctors don't even know what it is. And they come to us with a preconception of how to fix that or how not to fix that. And do I have to have an incision to fix it and stuff like that. So we'll go through that a little bit. But, the body changes, not just as we age. We all know that, even men understand that. But from a female standpoint, your hips can change, your pelvic girdle can change, the shape of your body can change. And so we've got to understand that, we've got to realize that, and then we've got to do what we can to come up with a plan to get you the best figure we can for your new body, and if that's restoration to where you were back when you were 20, awesome. You won the lottery, because there aren't a lot of people who post-pregnancy can get back to exactly that. But there's some of them. And, if you're listening, you may be a candidate for that. It's all just kind of a question of how responsive your body was during pregnancy, after pregnancy, and kind of where you are now, All right. And then talk a little bit about, because I tell people all the time, like, what changes happen during pregnancy to a woman's body specifically? Like, let's talk about breast, and then let's also talk about stomach. Like what changes happen?
Yeah, so and
this isn't for everybody, some people are different.
Yeah, super common. See it every day. The breasts are going to lose a lot of volume. They're going to, get bigger when you're breastfeeding, and then you have potentially extra skin or volume loss and change in shape.
Right.
All those types of things happen with the breast.
Yeah.
Super common. It's not just one person or they did something wrong.
What's awesome is like when people send pictures when they're breastfeeding and they're like, see me in the shirt right here. Like I was breastfeeding and this is what I want my breasts to look like. You're like, oh, okay. All right. It's awesome. At least they lived with that science before and they know they love it. So it makes our job super easy, right? From a restoration standpoint. But yeah, so breasts will get engorged even if you don't breastfeed. Most of the time they get larger during pregnancy. There's weight gain with pregnancy. There's hormones with pregnancy. So all sorts of things happen. And then once that volume gets reduced, you can have some sagginess to your breasts, or you can just kind of lose that volume that maybe you didn't have prior to, but you had it at some point during your pregnancy, and you just kind of like the shape, which is kind of funny. And then talk about the stomach. What happens to the stomach to accommodate a growing uterus for a woman?
Yeah, so lots of changes, but really it's skin, fat, and muscle. Your muscles separate to accommodate that growing baby.
And so let's define that so that people understand what you mean when you say muscle separation.
Right.
Because I feel like some people would think like they tore their hamstring or something, and that's not the case, right? We talk about every muscle in the human body has an origin and an insertion. That's what we learned in medical school, right? The origin of the, and what a muscle does is it contracts. And when a muscle has an origin and an insertion and it contracts, it's going to bring the starting point and the end point closer together, right? And so if we talk about the muscles in the stomach, we talk about the origin at the base of the ribs, right? And then the insertion on the pubic bone, right? And the strip muscles that make up the six pack going vertically, right, are connected in the midline by a structure called
the linea alba.
Awesome.
And that's what gets stretched out.
That's right.
And so a lot of women have
white line, linea alba.
Even, thin, petite women who have a diastasis, a lot of women have a lot of back pain. And,
Sure.
And they try to exercise to get their muscles, tighter again. And it doesn't, you can't do it because they're anatomically
and if people
in the wrong
go,
place.
Right. And if people go and work out and do a lot of core exercises, they understand that there's like the core, right? We talk about stabilizers around your spine. We talk about obviously your abdominal muscles, and we talk about your pelvic floor. And that all works together.
Right.
So when people maybe TT a little bit, if they're jumping on a trampoline or if they laugh too loud or anything like that.
Yep.
Lower back pain, another like great example that people come in and they're kind of like, oh, childbirth wrecked my lower back, yada, yada. And you're like, actually, I don't know that, I guess kind of indirectly did because your diastasis, but we get improvement of those things when we correct that diastasis. And that's not everybody, full disclaimer, like individual results may vary, but it is one of these things where a lot of women see an improvement in that.
Yep.
And I think that's great because it's restoring the core back to where it was supposed to be. So it helps with anterior, posterior core chains as well as the pelvic floor. And if your muscles are stretched out in the front, meaning they are no longer touching in the middle, right? The muscles are fine. Like when people are like, oh, my muscles got damaged during pregnancy. No, they didn't. Your muscles are fine.
Right.
They're not being held together in the middle. And that's called separation or diastasis recti because the muscles themselves are called the rectus muscles. So what do you do for that during the tummy tuck?
Yeah, so technical term, we plicate the muscles. But
Can they
basically,
crunch their way out of that, first of all?
Can't crunch your way out of it.
What about like any of the muscle stimulator stuff like M-Sculpt? Can that correct it?
No, it's not going to get corrected until they're back where they're supposed to be.
Okay. And so tell us how we do that.
Yeah. So typically in layers, we'll sew the muscles back together, the fascia back together that's stretched out, and that brings the muscles together. And we typically do that with multiple layers of suture because when you're putting someone's anatomy back together that they use every single day, it has to be as strong.
Yeah.
So it's not like a facelift incision where you're just, one layer of stitches.
Right. So when people, it's kind of interesting though, because people ask me, they're also like, can I ever do a sit-up again after I get my diastasis recti repaired? And I'm like, you'll be able to do a better one.
Yeah.
Now your muscles are like in the proper vector. They're where they're supposed to be. I tell people like, look, the first thing I want you to do is not an inverted Rocky Balboa twisting sit-up, but eventually you'll get to that point.
Yeah, and a lot of women think that they need a tummy tuck and it's fat and skin.
Right.
But then they have this protuberant belly.
Yeah.
And, I don't know the reason for this, but I feel like a lot more African-American women have a larger diastasis. And I don't know why. Do you have a reason for that?
No, I don't know. It could be, sometimes it's like, did you have boys or did you have girls? When people talk about pregnancy and they say something like, I think it's a boy. I'm holding it, whatever, low or high or something like that. Because I get some people who have like beautiful, the muscles really come back. Like up north, it's come back, and south, it's underneath the belly button, it's wide, and I have the opposite. Mm-hmm. And you're like, so I don't understand a rhyme or reason for it. I don't know about, anything from like demographic standpoint, I don't know, but I do know that like some people come in and look 9 months pregnant still.
Yeah.
And you're like,
it's
holy
just interesting.
mother. It really
and they
is.
think it's fat or skin,
Right.
but it's really the muscles. And that's the main thing.
And so if they have excess fat and skin along with this muscle protuberance and they didn't fix, like if they come in and say, I just want a liposuction, what do you tell them?
You're not going to be happy with me if I do that. I'm happy to do it, but you're going to be mad.
Yeah, because it's not going to change their shape. And that's what I tell people too, is I'm like, if I pull your excess skin over a round object, it's going to be a tighter round object, but it ain't going to be flat.
Right.
You know what I mean? And so I think the most critical component to the tummy standpoint in restoring a woman's figure after pregnancy is bringing those muscles together.
Yeah,
right.
For sure.
100%. And so, all right, when somebody comes to you and maybe they've had difficulty in getting back to their pre-pregnancy weight, right? Because a lot of women are going to come in. I see it all the time. And, I was 135 pounds before my pregnancy. I got up to 200. Now I'm at 165. And I can't budge. But I can't look at my tummy anymore. Like, let's do surgery.
Right.
How do you educate that patient about, is there anything that we offer here that we can help them to get closer to their goal weight? Because theoretically, right, like they're exercising, they're eating better. And granted, there can be some changes to your anatomy that make it more difficult. Maybe you're not going to get back to the 135, right? But I mean, I can't really justify that somebody would be 30 pounds heavier after a pregnancy in the absence of just major hormonal changes that obviously I think they should seek professional physician guidance on that kind of thing. But what do you tell somebody about like the timing, trying to time their mommy makeover?
It's tough because, you want to help them. But an abdominoplasty is really one of the probably my strictest surgeries that I do about having you at the right weight.
Right.
Because I know you're not going to be happy with me if you're overweight. We do your abdominoplasty and you have this kind of shelf and it's just blocky and there's no shape.
Right.
And so I'd really try to help them get to that weight that I want them to be at.
Well, I also worry because that can be a place. Some women's breasts don't change with weight gain or weight loss, right? They are what they are. But you're right, the abdomen, just because we've got so many different kind of components to it, right? We have the internal fat component, right? That visceral fat component that can also add to your kind of round protuberant shape. And then you're right, we've got areas along the flanks and the lower back and places that we want a liposuction and help carve out for that patient to get him that perfect result. And then we've got skin. And it's like if we do a perfect surgery as good as we can at 165 pounds and they look awesome, and then they get motivated because they really feel great. Because people think that after they do a tummy tuck and they do some liposuction, we're going to take that 30 pounds off. What's the most you've ever taken off somebody from a weight standpoint for just a regular mommy makeover? Not a massive weight loss like craziness. Like, what do you think the averages are?
It's not much.
I know, right?
3 to 5 pounds,
right?
maybe.
Right, like maybe, and then they're going to swell afterwards, so they're going to weigh more.
And then
initially.
if they lose weight after, their abdominoplasty, then they're going to have extra skin.
That's right, and that's my point. Is if we don't wait, if we don't get you,
right. But there are things you can do, right? If they're totally they're in a spot where I can't lose anymore. I cannot do anything. I've been on a GLP-1. I'm working out. I'm eating healthy, and then we can stage your surgery. We can do a lot of liposuction first.
Yeah.
Because you really want to be thoughtful with your liposuction when you're doing an abdominoplasty. You really don't want to be too aggressive because you can run into issues. So sometimes I'll stage their surgery and I'll do liposuction first.
What percentage of your tummy tucks do you think you also do liposuction at the same time?
Probably 90%.
Yeah. Very few people that can't benefit from a little tailoring and liposculpturing, I guess, is like the sexier term to use than liposuctioning. But yeah, I just think that it's critical. I tell people, the front starts with the back, lower back and hips are a great area to do that. The flanks are great. I don't do a lot of liposuction to the front of the abdomen. I still am one of these kind of traditionalists that feels like the better overall result is using drains, is taking the skin and subcutaneous fat off of the muscle, repairing the muscle, and then pulling the skin to a tension that's appropriate, that doesn't make somebody look like they tucked their skin into their pants. And when I see some of the drainless, or I see some of the lipoabdominoplasties where they're really functionally using a lot of liposuction to try to untether those tissues so that they can then pull it down, it just has this very alien, very, it may look good in a photo. It may look good in an immediate post-operative on the table. Let's put a bunch of baby oil on this patient and change the lights around in the room. But man, 3 months, 6 months down the road, I just think that that's fraught with issues. Yep. I also think that anybody that wants to do excessive, overindulgent liposuction to areas to help with contouring, like etching, is making a critical mistake.
Yep,
your body's going to continue to age, and those are things that we just have a really difficult time correcting. And so I would rather, I think a little subtle liposuction is great. I agree with you. Sometimes I will do their tummy tuck, do liposuction to areas that won't compromise blood flow so that they can heal beautifully, and I can put that incision where nobody's ever going to see it, and it can heal with the prettiest scar because it's got great blood flow, and we're going to take care of it with tape, scar gel, CO2 lasers, all that kind of stuff. You can always go back on some of those people and do some liposuctioning once they've got the right amount of skin there.
And we've both seen the patients that come to us that have had too aggressive of a surgery done and have problems that are very difficult and very expensive to fix.
You can't. I mean, it's almost like, it's awful. I mean, I try to send those patients back to their original surgeon, not only because it'll be cheaper for that person to correct their own mistake than for me starting all the way over, but also just because it is a nightmare to take care of. And I just feel so bad for them. But I mean, it's best just not to put yourself in that position. These are elective procedures. So it's like, follow a safety protocol, do what you know is right. And what I tell people is never follow fads. Don't look at whatever social media is saying or whatever guy, because, he's showing you his best results, he or she. They're showing you their best results. And it's like, oftentimes you're seeing it at the best stage, which may be on the table. And I would prefer to do tummy tucks on people that come back after 2 years and don't look like they ever had a kid, and I got to try to find their scar, and that's when I, walk out of a room and I'm like, yes, I did really, really well. You know what I mean? All right. And so, talk about that kind of customization for patients and, briefly tell them, what type of liposuction do we do here? And then is there anything adjunctively that they can do along with the liposuction areas that we do? Because some people come in and it's a mommy makeover and it's breast, it's tummy tuck, it's liposuction, maybe to their thighs or maybe to other areas of their body, their arms and all those types of things. So what type of liposuction do we do here at our office? And what's an adjunctive kind of thing that people can use to improve their result even more?
Yeah. So, as a young resident in general surgery residency, one of my senior residents, who's now one of my best friends, would just get on my butt in the ICU. He's like, the devil's in the details. I'm like, whatever, man. And it really is, the devil is in the details. The little things add up to that excellent result.
Yeah.
And so when I'm talking to a patient and, there are little things that I think we should do to make that result go from an A to an A+.
Yeah.
I tell them that. And some examples would include, Renuvion or Morpheus for skin laxity when we're doing liposuction to different areas like the inner thighs or the arms. Those are really great areas that are also high risk for having extra skin or contour irregularities if you don't do those things. Fat grafting is a great adjunct that we do a lot of for the hip dips when we do liposuction and abdominoplasties.
How do you? I feel like, what percentage of the time do you think patients bring up things like hip dips to you versus like, do you bring it, like, I just don't have a good way of bringing that up to patients because I don't ever want to point anything out.
I just don't ever like to bring up something to a patient.
Yeah, right.
I really don't.
Yeah. Yeah.
I mean,
so these patients are saying, because
they're like, I love my butt.
Yeah. Yeah. I agree. There's some areas like if we're Rob and Peter, let's go pay Paul.
Right.
If we're going to do a little bit of liposuction, using that fat is great to try to fill in some spots. But I just don't, I just don't want to make somebody feel self-conscious.
But I do tell patients, like if we're doing a lot of liposuction, then we can use that fat instead of throw it away if you want.
Yeah.
I'm happy to. But
I think the main thing is using it an appropriate amount and using it in areas that are like tried and tested, right? I think that just kind of globally, I'm not a huge proponent of using a lot of fat to help shape or augment a breast. I think that you can get calcifications and fat necrosis, which can lead to patients needing to get biopsies and just really throw things off. And I just think that like implants are so safe and so wonderful. And we even have like a newer generation of implant out now. That's just wonderful that there's really no reason with education, right? I mean, some people are like nothing foreign. I'm like, I get it. Like I'm not going to try to talk you into it. I am going to educate you and I'm going to tell you the data and then you can make a more informed decision. And if it's still digging your heels in on this, absolutely awesome. I mean, I tell every single patient, if I can get you to your goal breasts without an implant, I would take that every day.
Right.
So, but now we've just got such beautiful implants that it really changes things, Yeah,
the implants are way better. I'm actually doing my first saline breast.
How dare I didn't even know we knew how to order those.
And I haven't even done one in 3 years. So.
Jeez, yeah.
I mean, same surgery, but always use silicone implants because it's just a much better result for patients. But she did not want to do that. So I'm like, okay. Well, happy to.
Yeah, ultimately all you can do is educate.
Yeah.
I will know that I'll send all those to you. All the saline implants, all right? Just send them right to you. Okay, and so, we've talked about the priorities that women come to us with about aging. I also kind of, tell people that while we're doing mommy makeovers, which is by definition kind of breast and body, to think about other areas while they're asleep that bother them. So you mentioned arms, you mentioned medial thighs. Those are all, knees. I tend to tell patients to stay away from their lateral thighs.
That's tough.
Yeah, it's tough.
I mean, I've gotten some really good results in the last couple of years with that, but like the liposculpting the thighs is very difficult, and you have to understand the anatomy, and you have to really imagine during that whole surgery how you're sculpting. You're not removing fat. It's not like a flank liposuction where you're removing a lot of volume. No, it's very feathering. It's a totally different
it is. And it's a cylinder, and it's hard. Sometimes they've got, cannulas, liposuction cannulas, which is the wand that we use that are curved to help you. But ultimately, the majority of these cannulas are straight. And so you're using kind of a straight object to try to sculpt something that's a cylinder. And so that can be very, very difficult. I also think that on the outer thighs, unless you just have saddlebags and it's just really bad, I tell patients that's just an area that if you do reduce a bunch of volume, you can actually kind of make cellulite and things like that worse. And so obviously we have things that can correct cellulite. So that's another thing that you can kind of combine with the mommy makeovers if you don't like some of the dimpling. And so tell us what that is and how that works and what kind of adjunctive things you have found get an even better result than just using this device.
Yeah. So,
because I've seen your whole process and this change. I mean, you used to go to just cellulite.
Yep.
And then you're like, oh, I kind of want to do cellulite and add this. And then you're like, that worked. Now I kind of want to use cellulite, this and this. So, so how has your practice evolved?
So the thing with cellulite, I think I was the first person here in Charlotte to have this Ovally device, which is a great device for addressing cellulite. But in women who are 35 or older, skin laxity is a component. Yeah. So you have to address the skin laxity. You can't just divide those bands or else it's almost going to look worse or it's not going to get any better.
Yeah.
So you really want to treat them with radio frequency energy like Morpheus or Renuvion.
Yeah.
And then the other thing that I've been doing recently is adding some aloclay, some fat.
Yeah. What's aloclay?
Well,
what do you mean?
Aloclay is it's a it's a cadaver scaffolding. It's basically a filler for the body.
Okay. Is it permanent or do you have
and it's permanent.
Wow.
And you can use less of the product than you would if your own body's fat. And it basically is a scaffolding for the body to kind of repopulate that area with fat.
So it's regenerative almost.
Yeah, exactly.
Super neat. And so, Aliclay's been out for a minute. Like, this is not something that, and they're getting one for the face called Dermaclay, which is great. But yeah, I mean, for some of the women that have cellulite and they don't have a fat reservoir for us to liposuction and use,
right,
this is an amazing alternative. It's also something that people can do under local, which is also super cool. And so, I've seen you go from just using the ovule to doing ovule and fat grafting to kind of fill in the space that's created when you lift that band, right? So that it doesn't retract back down. And then doing both of those and improving the skin quality by doing the Morpheus radiofrequency microneedling.
Yep.
And I think the combination of those three things in the right patient gives a much better result than either the twofold and certainly the one-fold approach.
It does. And the legs, the thighs, the buttock, skin laxity is probably one of the hardest things that we deal with.
Yeah.
And so you have to approach it in a multifactorial way. You can't just address the skin laxity or, fix the cellulite.
Sure.
You really, if you want to get the improvement that patients are coming in and asking for, then you kind of have to do all those things. And that's what I've really learned over the last couple of years.
That. All right. And then talk about recovery roadmap for somebody that's getting Mommy Makeover. So we'll just define that as they're getting a tummy tuck, they're getting their muscles back together, and they're having some little bit of liposuction to some area of their body, and they're getting their breasts done. So what should they expect from a timeline standpoint?
Yeah. So first week,
I've got that reunion, right?
Right.
When do I need to do this? So let them know.
First week you're going to be mad at me.
Okay.
It's more of a painful recovery, less painful than patients think, but it is.
Yeah. It's real.
The first week's pretty rough.
It's real.
Second week you're standing up straight. One of your two drains is out, or both of them are out, and you're feeling a lot better. By week 4, it really depends on how much I have to correct your diastasis.
Yeah.
If it's a large diastasis, then I'm going to really limit a lot of your core activities for a good 8 to 10 weeks.
Yeah.
But most patients, 4 to 6 weeks, you're back at it.
Am I back to being a mom? When am I back to being a mom? When can I drive my kids? When can I go back to work? When can I feel comfortable for a couple hours going out and doing something?
Yeah, I mean, towards the end of that second week, you're feeling a lot better.
Yeah,
for sure.
Yeah, you're not driving
week
yourself
3,
to that first week appointment,
right?
You know what I mean?
I mean, the hardest thing for moms is they've got a lot of them have little babies, and little kids that they got to pick up and take care of, and so that's the big hurdle for them. Really, that's probably the biggest hurdle for them.
Yeah, it's almost a social hurdle more than it is like a physical recovery hurdle. You know what I mean? But if you can have somebody that helps, you have a helpful spouse or partner or mom can come in town for a little bit. That works out really well, which is awesome. But those are great. And then I'm going to take the choosing a provider red flags to look out for, because I've talked to you about this because I've got so many patients that come to me and they'll say, oh, I've been to 2 other consults and this person, man, they wanted to do this, and this. And I come out and I immediately grab you and I'm like, can you believe this bozo wanted to do all these things? And a lot of times it's adding things to a surgery just to kind of make it seem more, I don't know, certainly more expensive, but like somehow it's adding value. Like when somebody comes in and they get internal bras, and I'm like, what?
I had a 23-year-old girl who I'm seeing for a breast lift today, and she was asking why I wouldn't do an internal bra. So I had to educate her on that.
Yeah, because you don't need it.
Like, you're 23 years old.
Yeah.
Yeah.
And it's just, and I think we've got study after study that have shown us that for that, there's no long-term value to it.
Right.
And so certainly just these people who pop off and add mesh and add the internal bra to breast augs, to straight up augs, is just wildly crazy, right?
It's definitely very trendy.
Yeah. Well, and what I've always preached is stay away from people who are trying to sell you all these trends, because it's their results aren't what are getting them patients. It's their marketing. And I know how important marketing is to every business. I understand that, but I will die on the sword that the best marketing as a plastic surgeon are your results. And I can't tell you how many times I've gotten a pic from somebody and they email me and they're like, oh my gosh, I was just down in Charleston with a bunch of girlfriends and we had a beach trip and there's like 12 of them. And they're like, we had no idea you operated on all. And I'm like, oh my gosh, like I did that entire trip. Like that's amazing, right? And you're like, that's awesome. You know, because one person kind of tells one of them and then that person keeps that a secret, but then it goes. And so person 1 doesn't know person 12 went, but you're like, man, this was awesome.
Makes what we do so much fun.
Yeah, 100%. And it's like, you know, trends are awful.
Yeah.
Trends come and go. And if anything comes and goes, it means it wasn't worth a damn, you know? And so I would tell people to stay away from people who just knee-jerk adding a bunch of excess things on. I would also stay away from doctors who don't ask you what your weight goals are or what your health goals are and don't help you try and get there prior to surgery. And now I'm at the point in my career where it's like, I don't want a good result. I want an awesome result. And so you can find a plastic surgeon somewhere in this town, probably on this street. You can find a plastic surgeon that will operate on you tomorrow. And I'm like, first of all, you never want to operate on somebody who can operate on you. Like, you never want someone to operate on you who's not booked out a little bit.
Right.
Yeah, that means they're not very sought after, especially when you've been at it for 15 years like I have. And I just tell people, if they're not asking you what your health and fitness and lifestyle goals are, ultimately, that's a huge red flag to me.
Yeah, and we talked about it earlier, but a surgeon who tells you this is what we're going to do, this is what you need, implant size, whatever, that's kind of a red flag too.
Yeah, I mean, agree.
I think we're educators and surgeons, and we're here to help them come to a decision that what their goals are. Because and I ask people, just meeting you. Yeah, the first time I'm meeting you, you're interviewing me. I'm interviewing you. Right, trying to figure out what you want. Yeah, and I tell people, I say, you know, I want pictures. Like, give me wish pics. I want to know. Like, I'm a visual learner. That's why I went into plastic surgery. So I don't want to talk bra size. I don't want you to say whatever you think. I do not like that. I want some guidance. Because it doesn't matter what I think. I mean, it does, but you know what I mean. Like, ultimately, that's not who I'm trying to impress. I want you to love your body. And if they say something that is not attainable, then I'm going to tell them that too. 100%. Also critical. Right. All right. If this episode sparked questions or helped you feel less alone, make sure you're subscribed so you don't miss future conversations like this one. If you know a mom who could use this information, share this episode with her. These are the conversations we need to be having more openly between ourselves and with our patients. When you're ready to explore your options or want personalized guidance, schedule a consultation with either Dr. Zoog and I who understand modern mommy makeovers. Visit Garrett Harper Cosmetic Surgery online at ghsurgery.com to book a consultation or call us at 704-375-7111. Your voice matters to us. If this episode sparked a question, visit ghsurgery.com and click on the dedicated The Doc Dudes link to submit your feedback. Make sure you're subscribed on Apple, Spotify, and YouTube Music so you don't miss our fresh episodes the last Tuesday of every month. Follow us on Instagram and Facebook for the latest on our practice. We are signing out. This is Dr. Garrett Harper along with Dr. Evon Zoog.
Peace.